Hello, and thank you for joining this SkinSideOut webinar this evening. This evening's webinar is on HS, Hidradenitis Suppurativa, and we have decided to have the webinar tonight to coincide with the Global HS Awareness Week. Before we get into the webinar, what I will do is just introduce our speakers for this evening. We have Professor Brian Kirby, from St. Vincent's University Hospital, a consultant dermatologist. We have Barry McGrath, patient advocate and HS patient research partner from CORD. He's also the co-founder and I suppose the runner or the manager of the HS Ireland Patient Support Group. And we have Suzanne Maloney, who is also a HS patient advocate, and I suppose an engineer, an inventor, and a businesswoman. And we'll be hearing quite a bit from all three as we get through today's program. So a few things first, I just want to draw to everybody's attention. We will hopefully have some questions at the end of today's webinar. And we'll hear first from Professor Kirby and then from Brian and Suzanne. If you wouldn't mind, please switch your screens or your laptops to listen only mode. That will help just with sound interference in the background as we are recording this evening's webinar, so that it can be watched by people on the Irish Skin Foundation's website over the next few days. So please take a few minutes as well to fill in a survey, which you will have received after you registered for the webinar. And this will just help us figure out how well we have done today and how we are planning future webinars. And you are also very welcome to post questions that are relevant to any of the topics today. And we will, again, time permitting, select a few at the end for further discussion by the panel. If you have any specific questions about your own skin condition, you feel free to send us a query about that through the Irish Skin Foundation's website. If you just look for Ask a Nurse, you can send a question to our helpline. We'll do that tomorrow, and we'll be able to get back to you in the coming days about that, and hopefully give you some good information. I just have the contact details of the helpline up there, and we'll also see a picture of our booklet, which is called What You Need to Know About HS, and it's one of the series of booklets that we have. We also have ones for psoriasis, eczema, and acne forthcoming, and a few others on our website, which you may find useful for someone you know who's who's living with a skin condition. So without any further ado, I'm just going to unshare my screen. Very good. Okay, so my name is David Mcmahon. I am CEO with the Irish Skin Foundation, and I would just like to I'd like to begin by welcoming everybody this evening, and of course welcoming our panel. So hello everybody. We've had a few minutes to discuss HS broadly before we joined everybody today, and when we were talking about it, I guess the condition in advance of the webinar, you know, the thing that we decided was probably the most relevant was that HS is often the condition that people find most difficult to talk about. I think we'll be touching and returning to that theme a few times, you know, today. So I suppose really we might start by asking Professor Kirby. It's a huge subject, Brian, and I know you're a specialist in this area. Where would you start, I suppose, bringing somebody up to speed on HS, and what is it?
So HS, from a patient's perspective, in the just purely skin sense, is the development of boils or abscesses in areas under the arms, in women under the breast area, and in the groin, genital, and perianal area. And if you are getting recurrent one or more abscesses in these areas, and this has occurred in more than a 6-month period, so you get a flare, it settles or may not settle, and it continues to persist, and this has been going on for 6 months or longer, the likelihood is that you have HS. And I think that's one of the important things that maybe HS Awareness Week is, if you're getting recurrent boils in these areas, you do need to ask your doctor to see whether you've got HS. So what's happening in the skin from a dermatologist's perspective is that the immune system is behaving abnormally. People sometimes say, when I say this to them, oh, it's my immune system is weak or my immune system is run down. Actually, in HS, the immune system in the skin is a lot more active than it should be. And the question that we haven't worked out yet, or it hasn't been worked out, is why that is the case. But we do know that there are certain parts of the immune system that are way overactive, and that this results in this recurrent flares of boils and abscesses in these areas, which are very painful, weep, and cause a lot of pain and psychological distress to people. Things, however, have improved in this. So this is really where we would have been at maybe 10 years ago. And we were just talking before we came on air this evening to say that this is an under-recognized condition and an under-diagnosed condition. So a lot of patients will eventually get a diagnosis. The average is up to 7 years after they first present with symptoms. And most people present with symptoms in their teens and early 20s. And they can have a miserable time at least waiting for a diagnosis. And probably the reason this is underdiagnosed is that it is just because it looks like boils or abscesses, if you're not aware of the condition. So part of Awareness Week should really be amongst medical professionals or healthcare professionals in general, that boils and recurrent boils and abscesses in these areas are HS or may well be HS, and that needs to be diagnosed and treated accordingly. And patients often find frustrating because what happens is they end up in the emergency room with acute abscesses when they're in a lot of pain. They're seen there. Sometimes they have incision and drainage of the abscesses. They're given a short course of antibiotics and they're sent on their way, which is what emergency rooms are for. And this happens recurrently. They go to their GP, get a short course of antibiotics. So I think awareness amongst the general population that if you are getting these symptoms, there is a chance that you've got HS. And the second is awareness amongst healthcare professionals that this exists. The improvement that has occurred in the last 10 years is that it is more recognized than it has been. And certainly now that we've got strong evidence-based treatments, both for the abscesses in the skin and also the recognition that the immune system in the skin is overactive, but that when HS is severe, that the immune system generally or systemically, not just in the skin, is overactive, and that has knock-on consequences, including feeling tired. A lot of patients, if you get a fever or you have the flu, one of the symptoms that you get is tiredness. We see this with COVID because your immune system is fighting the virus. There isn't a virus in HS. It's the immune system is just overactive in an autoimmune sort of way. It is reacting against elements of the skin. And nonetheless, you will feel tired and a lot of people will feel unwell when this happens. This has consequences for people's health in general, how they live their lives. Certainly quality of life is massively impaired with people with HS. What job you do, your relationships, your hobbies, how you live your life. A lot of people, as a consequence of having HS, often develop depression. And so there are psychological consequences of having HS. And I think we'll probably talk about these later, but when somebody comes to see us now with HS, we need to recognize that patients may have psychological distress associated with this. There are certain things that we do in our lives that make HS worse. If you're a smoker, it makes it worse. And I think sometimes medical professionals are saying, oh, well, this is related to smoking, you should stop smoking. This is a very simplistic attitude. We've recently looked at smoking in our people who attend St. Vincent's with HS, and the average age of starting smoking is 14. So when you're 14, you're a child. You're not allowed to drive a car. You're not allowed to get married. You're not allowed to legally buy alcohol. And somebody's giving you a highly addictive substance like nicotine. And 20 years later, you're suffering with HS and somebody glibly says, give up cigarettes. But cigarette smoking is associated with HS. And we've actually developed a program of trying to get smoking cessation service in our clinic to help people stop cigarettes. But it's not a question of just saying stop cigarettes. This is a deep-rooted addiction in most people, and it needs to be dealt with in that level. If you're more overweight, HS tends to be worse. And again, it's simplistic for doctors to say, just stop, reduce your weight. Weight loss is a very difficult thing to do. And again, that needs to be management as part of the overall care of HS. The sort of first line treatments for people, how we decide what treatment we give people, because there are guidelines laid out based on trials and based on evidence as to how people should be managed optimally with HS to minimize their risks of side effects and maximize their risks of getting rid of the disease or controlling the disease. First line treatments tend to be antibiotics, but this is not an infection. And that's sometimes a barrier for people to understand, and including many doctors to understand. So antibiotics, as well as getting rid of bacteria when you have a sore throat or chest infection, also have an anti-inflammatory action. So they change how the immune system works generally and also in the skin. And so HS isn't contagious. That's really important. And HS is not a hygiene issue. In the past, people were given antiseptics to use. And again, people thought for some reason, well, this must be something I'm doing. This isn't things that people are doing. This is certainly not a hygiene issue. But antibiotics, because of their anti-inflammatory action, can help HS. So we usually start with tetracyclines, but you need to be on them for 3 to 4 months. So a short course of antibiotics, while it might help with an acute flare, will not treat the overlying condition. And tetracyclines used over 3 to 4 months are extremely safe. And in somebody with the milder stages of HS, and I'm not saying it's ever mild, but less severe forms probably is a better form, between 60 and 70% of people who go on antibiotics for 4 months will notice a significant improvement in their disease, and in some of those patients it will switch off. However, that leaves you with 30 to 40% of patients who don't get better, even with relatively less severe disease. And there's a combination of antibiotics that we use next, which is more powerful than tetracyclines alone. It's called clindamycin and rifampicin. And the reason they aren't used first line in people with less severe forms of the disease is because they're associated with more side effects. So they are associated with diarrhea uncommonly. They can cause changes in liver function tests. And one of the antibiotics, rifampicin, can interfere with a lot of medication that people may be taking for other reasons. So they have to be done with care, and it has to be done usually with specialist care. Nonetheless, the studies have shown that 80% of people with less severe disease will respond after 10 weeks of antibiotics, and that up to half of those people will stay in remission for a year and a half afterwards. So that's a pretty good response. What we're trying to, people who then don't respond to those and or get side effects, we get severe diarrhea for these or changes in your liver tests. And then the next big advance in the last 10 years has been the use of biologics. In between this, there are other treatments that can be effective that are non-antibiotic related. There's Metformin, which is a diabetes tablet, also has an anti-inflammatory effect in the skin and can help HS. And it works in about 50% of people. And again, you can see we're looking at 50%, and we're hopefully getting to smaller numbers as time goes on. Dapsone is it's an anti-leprosy agent, but obviously HS isn't leprosy. And again, is used in specialists by specialists because it has certain side effects that obviously we tell people about, but it's pretty safe drug to take. Again, about 50% of patients will respond in those who failed antibiotics. But failing that, sorry,
I was just going to ask you. So together, this pathway that you are sketching out for us here with all of the antibiotics and the different potencies,
yes,
as it gets stronger and moving then on to a biologic treatment like that, this sounds to me like there's a very structured way of approaching HS now, like in a that it is it doesn't appear from what you're saying that there's a hit and miss element to it.
Well, I think it depends if you were. This is a tried and tested, method, and this is based on groups of experts sitting around working out the best thing for the patient in terms of their general health and in terms of side effects they may get from the medication. And those of more severe disease do need biologics and may need surgery with biologics. So that has to play a role, and we generally see surgery as an adjunct. It's not that you're really bad, you need surgery, you get nothing else. That surgery goes with medical treatment in those who are more severe. And they may not necessarily, if they come in on day one and they're in that severe category, we'll be recommending some form of surgeon done by our surgeons in conjunction with starting something with biologics. And often patients with HS will need combinations. Biologic treatments, and adalimumab is the licensed one for HS, has got about a 50% of people will get 50% better. So it's not magic. But when it's combined with other treatments and combined with lifestyle changes, hopefully, and combined with dealing with other issues such as depression, we see a really good treatment plan for people, and that we hope that the majority of people will get better and do not have to live miserable lives with this. And the future is bright because there's a lot of research going on in exactly what is wrong with the immune system in the skin. And that has led to some targeted treatments that aren't licensed yet, but that we use in the clinic. For example, there's a drug called Stelara or ustekinumab, which blocks a part of the immune system that's overactive in HS. It's not licensed for HS, is unlikely to be licensed. Nonetheless, we use it in an off-licensed fashion. There's another drug called brodalumab, which targets IL-17, which is another part of the immune system. But there are various bits of the immune system that we recognize are abnormal in HS, and we now have targeted therapies that can block these. So, we really are very optimistic about the care for people with HS. And the last bit to say to this is, before I take up too much of your time, is that early treatment we now recognize as essential, that it's easier to treat people with mild and moderate disease than people with severe disease. We hate to see people coming in the door at the end of this journey. We would far rather see them earlier and get them on those appropriate algorithms that have been worked out.
Yeah, because I was just going to ask you about that, about critical junctures in access, actually, and you run one of the biggest, if not the biggest, probably clinic in the country for seeing people with HS. Like, are we are we doing nationwide, in your opinion? Do you think we're doing well enough to be able to get people in at critical junctures, or do we still have work to do about that?
Well, waiting lists in dermatology are poor, as you know. There's been a model of care published just recently about what may be done about these. And it's the same old story in health services across Europe, but particularly in the Irish health service, where we have less specialists per head of population than most other countries in Europe. And you're well aware of this as CEO of the Irish Skin Foundation. Nonetheless, I think it is recognized that if people have HS, there's two things are recognized. One is that it's an awful disease that really can ruin people's lives, and it should be prioritized. And the second bit is that I think it's becoming clearer in the last few years that earlier treatment works better. So that if we can get people at an earlier stage, that they won't end up, as well as having to wait and live lives of a lot of pain, a lot of discomfort, and the psychological distress that causes, that it's purely from a looking at HS and getting it better, but it will be easier to treat the earlier it's diagnosed.
Okay. And just for everybody tuning in tonight, the HS booklet that we have on our website just contain a kind of a summary of a lot of this information, as does our website. And if you want to ask any questions to our nurses through our website, please feel free to do that, because I know there's a lot of information in today. Now, before I bring Suzanne and Barry into the conversation and kind of ask them to introduce themselves a little bit, just before we do that, would you either of you like to, I suppose, say anything about Brian? Has kind of unfolded quite a lot of information there. Would either of you like to kind of, I suppose, make a contribution on foot of that first?
Yes, please. I'd like to ask Professor Kirby a question, and that is, how important is it for your HS patient? I won't say average HS patient, because there aren't any, we're all unique, but how important is it to get to see the likes of you, the dermatologists? Because a lot of people, they are happy enough with their GP, but as I understand it, the GP is limited in what they can do for you. It's only when they get to the likes of you that, the bigger treatments, the more powerful and potent treatments. So, and because of the waiting list that you mentioned, should we get the process started to get to see the likes of you as soon as possible?
I think so, Barry. I would agree with that. I think the first thing is certainly the first line antibiotics, which are tetracyclines. GPs are more than capable and qualified and experienced in using those. I think the big stopgap is getting a diagnosis. And I think part of the awareness from the Irish Skin Foundation, part of what we're, hopefully doing now is, and I think that has improved over the last number of years, is that GPs now recognize that this is HS. And So then once the diagnosis is made, tetracyclines, minocycline can easily be prescribed in primary care. Most general practitioners are comfortable with this because they're used in acne and they're used in other conditions. And I think if somebody comes in with moderate to severe HS on day one, and they should be started on the antibiotics, and I think they should be referred, given the fact that the waiting lists are long. Yes.
Just an add-on to that, if you don't mind. It takes, on average, there were some studies done on this, about 2.5 years for a teenage boy, a teenage girl to pluck up enough courage to go in and talk to their family GP in the first instance. And what we're doing tonight is we're trying to start the conversation and get people talking about it. People don't want to talk about it at that age. They're conscious about their bodies. And because it's the intimate areas makes it all that bit more difficult. There's a sense of shame, there's stigma associated with it. So I just feel it's very, very important to actually start talking about this and start talking about it openly. People need to realize that they haven't done anything wrong as such. Sure, there are things that you can do to help further down the line and so on. But just in light of that it takes 2.5 years, and then you alluded to the 7 years then to get a diagnosis on top of that. So that costs the patient, because by the time they get to see you, they can be in a very, very severe state. And that frustrates you because your hands are tied in how you can treat them and how your colleagues in dermatology can treat them. And it also impacts on society, because I may have to go in for surgery and I need all these specialists, et cetera, working. So it's impacting the patient, the physician, and society at large. And that's why events such as tonight are so important. And just one takeaway message that I'd like to urge, and I'm sure Suzanne will agree with me on this, is to talk about it. Go in and talk to your GP. Go and talk to Professor Kirby. They have a very good understanding of how to help you. And as Professor Kirby mentioned, there's a tremendous optimism within the HS community at the moment. There's been more papers published on HS in the past 2.5 years than there have been in the previous almost 200 years since the condition was described. Research and interest in HS is exploding, and that will lead to better treatments down the line. And we all need to work together to help that and put people, those yet to be diagnosed, those just being diagnosed, that they'll be in a better position than Suzanne, I, and many others have had to endure the past while.
Couldn't agree with you more, Barry. I think that's a really good idea, and maybe the Irish Skin Foundation can play a role in promoting this amongst adolescents, amongst younger people, so that this isn't something awful. This is something you should talk about. This is something you should get medical attention for. I couldn't agree with you more.
I'd also add to that when my family and friends did find out about my HS and how much I struggled with it over the years, they were so upset that I never told them, and they felt so guilty themselves. So there was this whole other element of I suppose our relationships that have since, like, I suppose I have a great relationship with my friends and family anyway, but just the fact that I hid this from them for so long really hurt them as well, because the minute I told them, they just couldn't have been more supportive and wanted to help anyhow they can. So in my head, and probably in a lot of other people with HS, we think it's a lot bigger to talk about, a bigger deal to talk about than it actually is. Once you've told someone about it, someone you trust, the response is usually very positive, and people just want to help you and support you.
And Suzanne, just as you started off there, just talking about your own experiences with your family and your friends, maybe you might just tell us a little bit more about how you began to develop HS and how about your own kind of path to diagnosis.
Yeah, so my experience is a classic case, just as Barry described. I was a 13-year-old girl when I started getting symptoms of HS in my bikini line, and I was very embarrassed about it, and I did feel a lot of shame. We were just learning about sex in school, and our bodies are changing at that age, so I definitely thought there was something wrong with me, and I hid it. I hid it until I was about 17, and it got really bad. So I eventually just told my mother, and she brought me straight to the GP, and the GP gave me as Dr. Kirby described there, a short course of antibiotics to treat kind of an acute boil, and it went away. So it kind of was resolved but they kept coming back. And actually, another point about going to see your doctor is also enabling your doctors to see you, and they have to see it to be able to diagnose it as well. So if we're hiding it and delaying going to seek treatment, we're not giving the doctors the opportunity to diagnose it as well. And in my case, my doctor that I first went to actually retired. So then I was moved on to a new doctor, and they weren't able to see the kind of the pattern of my symptoms, as I wasn't describing them properly as well. So I like there was a whole kind of sequence of events that delayed my diagnosis further. And I was eventually so this kind of went on for a few years, where I went to college then, and I started going to a different doctor that was close by to my college, and was eventually referred into a surgeon, actually, after an emergency surgery. God, there's so many doctors, actually, it's hard to keep up, but I was eventually referred to a colorectal surgeon because there was this suspicion that I had Crohn's disease because of the location of a lot of my HS, and I didn't. But that once that was ruled out, the surgeon did some digging, and he diagnosed me. So he was actually a colorectal surgeon, and he diagnosed me and referred me into a dermatologist. And I'd already had several surgeries at this stage, and I'd been through tons of antibiotics and different, I suppose, treatments. So yeah, it took me almost 10 years to be diagnosed properly. But I suppose it's bittersweet when you do get the diagnosis then, because you have a name to the disease, and then you have a bit of hope. And I suppose as the years go on and you've tried new treatments and different, all sorts of treatments, I'm sure myself and Barry can write a list of the different things we've tried, traditional treatments and all sorts of alternative things as well. And I suppose the biggest thing for me was trying to just come to terms with the fact that I have this disease, and to adjust my life and my lifestyle to suit it, rather than trying to chase a cure that doesn't necessarily exist. So I'm at peace with it now, and I do have really bad days, definitely, when I'm in pain or I'm having a major flare up, but it's fairly well controlled for the most part. And when I do have bad days, I definitely allow myself to just relax and rest, because as Dr. Kerr said, there is a lot of fatigue. It's not just a skin disease, there's a whole range of other symptoms that can affect you, and when you feel unwell, you just have to rest. For the most part, I've tried to adapt my lifestyle to not let HS stop me from living my life.
And you have a particular, I mean, like, obviously I know you a few years, so I know your story, and I know how what you're doing now and how you came about to what you're doing now. But you had a very particular challenge around the practicalities of living with HS, and you decided to do something about that. Do you want to tell everybody the background story?
Yes, so I actually trained as a chef, and I used to work in hot kitchens, and I'd be on my feet a lot and using my arms a lot, and trying to keep dressings in place. In particular, my armpits was a very big challenge for me. And trying to do a dressing change in work as well, where you're kind of in a cubicle that's shared with different people, and it was just not the cleanest environment to be managing wounds or kind of changing dressings. It was tough. I was also experiencing a lot of adhesive damage from just traditional adhesive dressings, and trying to keep them in place. So they would either be taped onto me so much that I'd be kind of damaging my skin, removing them and changing them, or I would lightly tape them on, and then they'd kind of move and fall off. So it was just a disaster. And I had always had an idea to create some garments and dressing combinations that would just make it really easy for me to change my dressings and go off about my day. And at a party, I was at a party actually, and I was meeting my friend's mother-in-law at her hen party, and my dressing fell out of my top onto the floor at that party. And I just, I just had enough at that stage. And I went home, and the next day I just emailed a product design. I said, I have an idea. I would really like to try and create something. And I started off doing this just to help myself. But when I started speaking to people online with HS, and I could see that I wasn't really the only person experiencing this, and trying to manage the day-to-day aspects of living with the disease was kind of overlooked. Not so much through anyone's fault. It's just kind of one of these things where we go to the doctor and we're kind of given a treatment kind of pathway to follow, and we do that, but then we go home and we're kind of on our own to a certain extent and trying to manage the disease. So it just really struck me that there's a huge need for effective wound dressing for people with HS, and that there was nothing really being done about it. So I suppose that's how I created HydraRare. And I actually showed it to a group called the Health Innovation Hub, who are part of they're part of Trinity and UCC and also the HSC. So it's kind of a collaboration for innovation. And I showed it to them, and they helped me to get onto a program at NUI Galway called BioExcel. So I moved to Galway in 2018 to learn how to develop this and make it into a real life product. So now it's out there, and it's really helping people that use it.
Yeah, and it's not only just out there, but 3 years later, it is reimbursed on. So this can be prescribed for people. That's wonderful news. It's a huge success, for you, and it's a great advance for people with HS. And if anybody wants to find out a little bit more about that, then they can talk to their GP about that, or talk to their doctor about that, because okay.
But
okay.
it's such a new way of even making dressings available to people with HS. Like, dressings typically aren't dispensed or prescribed in Ireland. It's not the norm, and a lot of patients will often get their dressings through clinics. Say, like Dr. Kirby's clinic might provide some dressings for some patients through the dermatology nurses, but it's not really the norm. So if anyone does want more information, they can just contact us, and we can send them an information pack to bring to their doctor. It's the most straightforward way of doing it, because it's just such a new concept.
And I know a lot of people go to huge expense to try to buy dressings privately that they're buying on Amazon, because they don't like their GP, or their pharmacist won't get it in because it's so expensive, or that their GP has a certain amount of it, but maybe the wound dressing nurse doesn't have a lot of it, and she can't have it all of the time. So the whole dressing side of things, this is just I suppose an advocacy issue really from across all the people living with different kinds of skin conditions, but it's huge financial burden for people, particularly if you're looking for something expensive or specialist. And I suppose, Suzanne, thanks very much. I'll just come back to Barry for a second. And Barry, I suppose you almost don't really need an introduction, because an awful lot of people in Ireland with HS will have actually encountered you through the HS Facebook group first, which you have been running since 2015. Is that right?
Well, in its first form, yes, it's 2015, but we've been in some forms for about 10 years. Okay. And just I suppose, there's a couple of things I just wanted to ask you about, before you might tell us a little bit again about yourself, or just remind us a little bit about your own story. But just, we were talking there about, Suzanne was talking about, looking at HS in the round, or sort of, I suppose, maybe a more holistic approach to HS. And again, we had touched on it earlier with Professor Kirby about alternative treatments and about complementary treatment and what is what. You've been in touch with so many patients, so many people with HS over the years. Do you have any advice for people out there, or do you have anything that you feel we should
I suppose, say to people about I don't know, snake oils, what do they call, sort of snake oils, etc.
Yeah.
out there.
Yeah, thanks for bringing that up, David. It's something I'd feel particularly strong about. In years to come, they'll look back at this time and they'll call it a golden age of information. Human knowledge is doubling every few years, and it's expanding at a tremendous rate. There's huge amounts of information out there about HS. Unfortunately, most of it is written in a form that only Professor Kirby and his colleagues can understand. I've been doing some ongoing research on this in recent years, and while there's huge amounts of information out there, the information, the readability, the quality of the information is disimproving over time. The digital age we're living in is fantastic in that we can access information from around the world at the touch of a button. However, you have to apply some critical thinking when looking at this. The great Dr. Carl Sagan used to say, extraordinary claims require extraordinary evidence. If someone says something that's quite big and quite profound, you must say, show me the evidence for this. And there are ways you can tell this. In the US, they have what's known as a HON code on any website that gives out medical information. That means that Professor Kirby's colleagues in the US have reviewed this webpage and they've given it the thumbs up to say, this is accurate information, this is verifiable, it has gone through rigorous testing, and yeah, we can say that with a certain amount of confidence. There's nothing to stop me, for example, from publishing a webpage saying, oh, I did this and it cured my HS or whatever. And there are a lot of people out there who may be willing to buy into that type of information because they're in tough situations. But you've got to look at things critically. Apply that extraordinary claims require extraordinary evidence to everything you do in this life, and it'll stand you in good stead. There are people out there who are only too willing to try and relieve you of your hard-earned cash, and unfortunately, that's the type of world we live in. On the one hand, there's fantastic information out there that Professor Kirby and his colleagues and all other healthcare providers are working tremendously hard to provide about HS. I alluded to the explosion in HS research. That's on the one hand, and then on the other hand, you have the cynical people like we saw with the cyber attack on the HSE. We're in a difficult situation and people are trying to prey on that and extract information. You've got to tread the waters very, very carefully. The group we run, we take that, we moderate all the content that goes into it. I'm not going to permit, none of us are going to permit people coming in making wild, inaccurate claims. Everything we link to has been verified. It goes to reputable sites such as the Irish Skin Foundation or to the American Association of Dermatology, and so on and so forth. My background is in life sciences. I work in the clinical trials industry. I have a PhD in life sciences. I know a thing or two about that area, and I'm not going to let people come in and fleece people who may be in vulnerable situations out of their hard-earned cash. So that's something we do take very, very seriously.
Yeah, and Barry, I think sorry, I hear a little echo there, but Barry, I think you know, the HS community is very, very lucky to have you as a kind of a gatekeeper for information. You know, it is to an extent a bit of a wild west out there on some, you know, although I think things are improving, and I think you can see research coming out now that is sort of highlighting, I suppose maybe it's a more discerning kind of attitude, I think, among people using the internet for medical information over the last couple of years. And Barry, you have also a bit of news as well, because you have already actually published a new website which takes your Facebook group to a completely new level.
Yes, we've outgrown the Facebook group. Our numbers have doubled every year over the past 3 years, and it's just become too big, and Facebook is restricted in what it can do. We've just launched a website, hsireland.ie, that's designed and written by patients, primarily for patients. Everything we have in it is linked to medically verified content and so on. We're not just putting up anything or whatever catches our attention or fancy. We link into a lot of scientifically reviewed papers that Professor Kirby will tell you about, goes through a rigorous process before it sees the light of day. It's critically reviewed by other experts and so on. We link into all of that, and it's not just me. There's been two people in particular working very hard in the background. Conor Walsh, who's a HS patient, and his partner Kate O'D, and they've put in tremendous work putting this together. I'm just the face of it. And so on. But yeah, it's been a team effort, and we're very, very happy about that. We are going to complement the types of resource that you have on the Irish Skin Foundation, and we can act as a bi-directional resource for each other. Because of my background as well in the clinical trials industry, in science communication, I'm going to try and take the exciting research that Professor Kirby and his colleagues are producing at an extraordinary rate, and try and distill that into a patient-friendly format. They're doing lots and lots of excellent research, and the problem is a lot of it's sitting on the dermatologist's desk and doesn't see the light of day. Some of this can make an impact on our lives right here, right now. One of Professor colleagues in the US is Jennifer Shao in the University of Tucson in Arizona. She just published a nutrition guide on HS last week. A year ago, she published a paper on what are the best undergarments to wear. Now, that's something that you can incorporate into your life today, and it can make a difference. It's not going to cure you, but it'll help enormously in your life. These are the type of things that need to get out to the patient. And again, this is where the beauty of the internet and so on comes into play. We can get that information as soon as it's published and get it out to the people who need it and to whom it can make a difference.
Yeah, and of course you're very active on social media, and you've always been very active. Like the last few years, I think your Twitter and your like I'd be less familiar with your Facebook, but much more familiar with your Twitter is very, very active. So it's great. It's wonderful to have the website to lean on in the back. And we've just shared that there in the chat feature. So if anybody would like to look at that, I'm sure you would, and click on the website. We've also, we have that reference on the Irish Skin Foundation's main HS page and in our resources section. And congratulations, Barry. And it's a wonderful thing. It's a big achievement. It's a huge job. You know, like we're looking forward to seeing it grow, and we're looking forward to being able to direct people to it as well that come to us from the helpline. So I suppose, like, I guess, you know, one of the things that I might just say about, you know, before I kind of go back to Barry, just about the support group, I suppose, Barry, you're very, you do refer a lot of people to the Irish Skin Foundation helpline. And I suppose for anybody who hasn't used the Irish Skin Foundation's helpline, we run an appointment model helpline where you can get access to a dermatology clinical nurse specialist who is in practice in an Irish hospital over the phone. Often the HS consultations tend to be longer, maybe up to 45 minutes, or perhaps maybe a few of them over a number of weeks. And I would just urge anybody who is, I suppose, who feels maybe they would like to just reach out to us and get some extra support along with Barry's group, to think about the Irish Skin Foundation's helpline as a free resource where you can do that. And you can, you know, you'd really have access to somebody who knows what they're talking about and who sees HS every day in their work. So I'm just looking at the clock here. We're up on nearly three-quarters of an hour. So we're beginning to come towards the end of today's webinar. Now, before I get there, though, I suppose I just wonder, you know, now that we've touched on a lot of different themes, what have we not touched on here that we really ought to flag and, you know, shine a light on before we finish up?
I'd like to add one comment. Professor Kirby's colleagues in the US, the North American HS foundations in the US and Canada have just published a psychosocial guideline for the clinician, highlighting the psychosocial impact of HS on the person. physically, physically it can be tough dealing with HS, but where I've always struggled would be the psychosocial aspect of it. They highlight 3 areas, and Professor Kirby alluded to them. He mentioned that a lot of people can end up having depression and anxiety as a result. There's a simple 1 or 2 questions that Professor Kirby can ask in the clinic, or indeed any physician, and they can get a good idea in a matter of under a minute as to whether you need to be referred for psychological counseling or whatever. Secondly, they also recommend assessing body image and sexuality. For me, that's had a huge impact, and I don't mind saying this. My solution to this, and Professor Kirby and other medics will call this a maladaptive strategy, and that was my answer to it was to adopt a celibate lifestyle. I enforce celibacy upon myself, and I know from discussions within the HS community that this is a strategy adopted by many, many patients. It's okay in the short term. You get out of the situation of having to reveal yourself to someone or to expose yourself in that regard. But long term, it can have profound consequences, and it can lead to depression and anxiety. In my own case, it led to suicide attempts and so on. And that's not a good place to be. There is help. Professor Kirby and so on can find out with just 1 or 2 questions, and they can send you on the right path. So it's important to recognize that aspect of it. Third area that these North American guidelines have recommended would be the financial considerations. I'm okay, I don't have any children, I'm in a decent enough job, but there were times when I was having multiple surgeries, was out of work, I was partially disabled, I could see no light at the end of the tunnel, and I was reliant on the state for handouts and for support from my family. That is another tough situation to be in. There are, in that instance, you can be referred for social help and so on. And again, 1 or 2 questions: how are you coping with the cost of wound care products, with over-the-counter pain relief? Something simple like that, and you can find out in a matter of moments. Those would be, Professor Kirby alluded to the HSE model of care in dermatology that was just announced. And again, they refer to psychodermatology services for HS patients and others with dermatological conditions. The skin it's your biggest organ. It's what people see when they look at you. Sure, it's going to be a big part of your psyche. And when your skin is impacted, it chips away at your psyche. And you've got to be careful, because as the World Health Organization first Director General said, without mental health, there is no physical health. It's all interconnected. And you've got to look after yourself from that point of view.
Yeah, and Barry, I think we will bring, because actually we hope to have a webinar in a few weeks that will cover, that will do an introduction and a sort of a summary of the dermatology model of care, so that people can kind of understand what it is, because I don't think a lot of people out there know what is a model of care and what's that actually, like, what is that? Is that a piece of, is that just something to put on the shelf, or is that like a plan? And we're going to go through that. And I think definitely, and I know Professor Kirby is interested in this as well, that the whole area of like psychological support is like the big elephant in the room, really, especially when you're talking about the potential failure of an organ, which is the most important organ of social functioning. So it's definitely a huge issue. And Brian, would you like to take say a word on the psychodermatology issues?
Well, I think the psychodermatology issues are there, and I think we're getting better at picking them up. Barry, as you say, we hopefully ask the right questions at the right times now. I think, but the problem has been that we access to services beyond that are less than ideal. Nonetheless, a lot of the issues can be dealt with by general practitioners. I think one of the things that we've got to stress, and maybe that I'd said earlier, is that there is hope with this. Treatments are getting better. This is not going to be a lifelong disease. I hope in the next few years that the treatments will be optimal, and that people won't have to live get into the psychological distress. But I think I couldn't agree with you more, Barry. I mean, recognizing that this is there and trying to find some psychological input or methods to try and relieve distress is absolutely important. And I think that's what we refer to, David, by holistic care, is that this is looking at people's physical well-being, both from a skin perspective, but also the issues around systemic inflammation and other conditions that are commonly associated with HS. That Suzanne touched on the fact that the surgeon saw she had Crohn's. There was good reasoning behind that, because people with HS are more likely to have Crohn's disease than people who don't. But also, Barry's far more eloquent than I am. There's no point in treating people if we're missing out on the other big organ that's important, which is the brain. And if we're missing that, and systemic inflammation interacts with this very intimately. So if you've got a lot of systemic inflammation, as well as feeling tired, it interrupts your mood. And vice versa, your mood under a stressful life changes how your immune system and your inflammation work. They are intimately connected. So looking at one and not looking at the other is not an holistic view, and not, we would hope that we are getting better at picking these up and sending people in the right direction. But as the model of care alluded to, there really is a dearth of psychological services, but I think that's something we will keep hoping to achieve.
Yeah, thank you very much. And Suzanne, would you like to say anything as well, just you know, on the towards the end on the psychosocial support, or sorry, the psychological support side?
Absolutely. I think the first thing I would say is to please do reach out to someone, and if you are struggling with your feelings and your emotions, just to talk to someone. And I know it's easier said than done. So there are so many ways you can reach out to someone, whether it's through a group like the HS Ireland group. And even if you didn't want to, I suppose, do it publicly, you could even message Barry privately and he can share your questions or concerns with the group anonymously. There's so many ways to talk to other people with HS. And the Irish Skin Foundation Nurse Helpline, I know that it's a fantastic service. And of course, your friends and family. One thing that I always do to try and put things into perspective when I am having a particularly bad flare-up or week or month sometimes, because they can last, is I try to put it into the context of my entire life and how that this experience is a part of it and it won't be like this forever. I always have to try to remind myself that it's not going to be like this forever. In particular after surgeries, when you're healing and you're kind of very bedbound and very dependent on people to care for you, and you know, you feel like a bit of a burden. I always do try to just say, this is a moment in my life, just kind of get through this, and there's brighter days ahead. So it's really important to try and stay hopeful and to stay optimistic. It's not easy all the time, but it does help. It helps me anyway.
Yeah, and I would just say, I would echo what Suzanne said there about just about the Irish Skin Foundation's helpline. One of the things, I mean, one of our nurses in particular is very, very, very strong with talking to people with HS, and you may know who I mean when I say that. And she works with people quite a lot, and she spends quite a lot of time with people on the phone. And I suppose maybe only a certain amount of the character of that conversation is about I suppose the medical side of HS, but a lot of it is about people's feelings, their attitudes to it, about their fears, and maybe helping them to change their approach to how they may think about HS. So I would encourage people to reach out, to us and to HS Ireland, if it's all a bit too much, or if you just are in a rush about your skin condition. We're just again watching the clock. We're nearly on an hour now, so I'm just going to finish with a couple of things. We were going to talk about very briefly research, and Professor Kirby has established his own HS clinic, obviously, in St. Vincent's, and he has had many calls actually for over the years for people with HS to collaborate in research with him. And I suppose, Professor Kirby, is there anything you'd like to kind of tell us a little bit about that? Is there any opportunities at the moment, or do you envisage any further down the line, maybe later this year or next year?
Well, the first thing to say is while I did establish this clinic, I now have a consultant colleague called Dr. Rosalind Hughes in the HS clinic. So we now have 2 consultants in the HS clinic, and we have got 2 research fellows there at the moment. We have, at the moment, we have several projects ongoing. We have basic science ones looking to tease out the exact role of inflammation in the skin. How does this immune system that is not working as it should do and is overactive, what are the precise details of this? We know a lot about this, but we need to know more. The second thing that we're looking for, we do have a clinical trial running at the moment, and I have to be careful because ethically and legally I'm not allowed to tell you what the trial is, but if you contact us, then I'm more than willing. And if Barry contacts me, I can tell him, but I can't tell you what it is. But we have a phase 3 clinical trial that is up and running, and that we would be happy to share information with people if they were interested, if they want to contact us. I can actually, Barry, what I'll do is I'll email you with an email address, because our emails are all damaged at the moment because of the ransomware. And Suzanne as well. I think so there are several, if you've got a HS and you're keen to participate in research, we've got, I'm just trying to think, somewhere between 7 and 10 research projects that are looking for people to be involved in if that's what they want to be involved in. But again, one of the things I say to people is we're not going to in any way, nobody's obliged to do this in any shape or form. I think the future of this is one of optimism. I think the other bit to say about research in HS, as Barry's touched upon, there has been an explosion of interest in this in terms of figuring out what this disease is. I think a recognition from the dermatology community that, basic science is important in this, and that from that treatments will come. And that other immunological treatments that are used in other fields may well adapt into HS. So I think if I've addressed your points, David, I think they're the major things that I want to say about that.
Thanks very much, Brian. That's great. And Barry, you wanted to get in there as well.
Yeah, just one thing in relation to your clinic, Professor Kirby, is that when someone joins our group, we automatically make them aware of your clinic, so we direct a lot of people there. But invariably, people will come back and send a private message to thank us for sending them your way, and to Professor Anne-Marie Tobin's, because invariably, both Suzanne and I have experienced this, and many patients do. You're passed from pillar to post. And I cannot emphasize how much it means to someone's psyche when they meet someone who knows about HS, who understands the impact that it can have on their life. And if people finally feel like, okay, I've got someone behind me and backing me here, and they're going to take care of me, that makes a huge positive impact on people, and we just wish to thank you. Now, I do have a wish list, and I would like to replicate it around the country. And
we have a wish list more than Suzanne and her fantastic achievements. We want to make it better. And it's very kind of you to say this, Barry, but I mean, we're just doing our jobs basically. Just want to say one thing, David, I can't forego in absolute awe of the two of you guys and other people from the HS community who come out, tell their stories and share their stories in a very public way, and are doing phenomenal work. I mean, your website is fantastic, and Suzanne, what you've achieved in terms of dressings, and you're right, we're not good at dressings. My hope, Suzanne, one day is that people won't need dressings for this. I'm sure you hope the same as well.
I do. Always hopeful for a cure.
But it is nonetheless a really important thing that we as medics aren't good at. I think nurses are a lot better at, but I think what the pair of you have achieved is spectacular in total of what you've done, and all of your other people who help out with your endeavors. I mean, fair dues to you, it's spectacular. But, and it's kind of you to say that, Barry, but we do our best and we will continue to improve, I hope.
I think the company I work with, one of the slogans is team of champions is always beaten by a championship team. And I think the way forward is for all of us to work together and to help each other, because we can all bring different things to the table here.
And I think that couldn't have said more. And last year, Suzanne and I met in Greece, in Athens, at a HS conference, I might quickly add. And we discussed about having patient representatives involved in research in HS, because, I think that's important. And literally 2 weeks later, I think, Suzanne, the world closed down. we got an email from the organizers to say there was a poor Italian doctor who got COVID who was attending the meeting, and I mean I haven't been on a plane since. But I think that is something that even tonight we may just talk about reactivating when things get back to some sort of normal, because I do think the HS community needs, input into what we're doing. And I think it's a two-way street. I think there are a lot of people out there who want to participate in research who can't. But I think also your needs and your voice in that is important.
Also, if I could just add, you mentioned a clinical trial. When I was diagnosed in 2006, I was working in the clinical trials industry, and there were 0 clinical trials. I did a search earlier today, and there are 157 clinical trials specific to HS. So yes, there are many reasons to be cautiously optimistic. Yeah. And also, in relation to people wanting to get involved in clinical trials, I lecture part-time on that specific topic, so I can give independent advice on
that's always helpful, but David will know one of our problems in Ireland is trying to get clinical trials attracted. So trying to get big phase 3 clinical trials, because the advantage of clinical trials are, from a patient's perspective, is that you will be getting access to treatment, depending on the trial, that may be very beneficial. And that occurs in a setting where you get really very good care. And now you may be on the placebo as well. So all trials are different and needs to be discussed in depth. But the majority of people, as you know, who go into clinical trials feel it was a worthwhile experience. Some people get really effective treatment that lasts for a long time. Now, again, I do not want to be seen to be coercive, but clinical trials benefit everybody generally as a rule. And our big struggle is the resource to attract clinical trials to Ireland. Because the companies will often look at it as a small place. There may be 1 or 2 centers that can do this, and they go, well, you know what, we'll just open up another center in Germany or in England because it's less paperwork and it's less hassle. So that's part of our job, is to try and attract clinical trials, high quality clinical trials, not stuff that is, the phase 3 trials where these have been through phase 2, where we know that there's a really good chance these are going to work and work very well. And that's part of our job, is to try and get those here.
Thank you, everybody. I just have a few very quick questions. What about the use of Herceptin nasal cream?
Do you want me to take that, or do you want Barry?
Well, I think Professor Kirby, you might be better equipped than.
I'm not sure about that at all now, to be honest. Herceptin is an antibiotic cream. So topical antibiotics may be effective for short term in HS. Herceptin has not been studied. And to the best of my knowledge, and Barry Creighton around, there are no randomized controlled trials on topical Herceptin. So the bottom line is, I'd prefer somebody to be on something else, be it a systemic antibiotic or topical clindamycin, which is called Dalacin as the trade name, has got some evidence for benefit in mild disease. Really, if you've got more significant disease, it's probably not going to do a lot for you.
Okay, thank you. And then one last question.
Can I just jump in? Because I was actually given Herceptin in my earlier HS days, and the thought behind it was that I was transferring bacteria from my nose onto my skin, and that was causing boils to erupt.
And there was a rationale for that. And there are some people who get boils where they carry a bug called Staphylococcus aureus. About 1 in 10 of us do. But with HS, it doesn't work, because Staph aureus, it was thought that Staph aureus was important in HS. We now know that it's not.
Perfect, thank you. And then just one last question again from Deirdre. Tetracycline, Brian, that you referred to at the beginning of tonight's talk, that is an antibiotic which your GP can prescribe. Is that right?
Very much so. Yes.
Okay.
And you would need to be on it 3 to 4 months for HS. So it's not something you just take for a week.
For a week. Okay. Thank you. So that's actually, they're all the questions that we've had tonight on the little button behind. So really, that's it for tonight. Can I just thank our 3 speakers so much for your time. That's Professor Brian Kirby, Barry McGrath, and Suzanne Maloney. And thank you for helping us raise awareness about HS in this HS Awareness Week. And good night. Thank you very much.
Thank you, David. And thanks, Barry. Thanks, Suzanne. That was a pleasure.
Thank you.
Right. Thank you.